All right. Hi, everyone. Thank you so much for joining us this afternoon for How I Got This Job, physician's assistant with our guest alumni speaker, Valentina Djordjevic. We're so excited to introduce her to you and to have her share her career story. My name is Debbie, and I'm from the Career Center here at DePaul. I work on our healthcare and science career community team. I'm joined by my colleague, Sabrina. We designed this series, How I Got This Job, to introduce you to alumni and to professionals, especially young professionals working kind of all across the healthcare and science industries. You might be familiar with some professionals, especially a nurse or a doctor or a biologist, but we wanted to introduce you to some other professionals and career paths within healthcare and science, and to open up some opportunities and paths that you might not be familiar with. We are recording this session and we'll send the video to you afterwards, hopefully tomorrow, if not early next week. And if you had friends or classmates who registered but couldn't attend, we'll also send the video to anyone who is registered in Handshake. And we'll send you the link. It'll just be a YouTube link, so you can share that as well. We will have time for a Q&A, so if you have questions, feel free to save them until then. If you want to ask a question anonymously, you can send it to myself or Sabrina, and we will ask it on your behalf. You can, during the Q&A, you can unmute yourself and ask a question, or you can type it into the chat. During the presentation, if you're able to, we would love to see your beautiful faces and turn your cameras on, but we understand that you might not be able to right now, and that is great too. So I'm going to turn it over to my colleague, Sabrina.
For sure. Hi, thanks for the intro, Debbie. My name's Sabrina. I'm also part of the healthcare and science career community at the Career Center. I will be sharing a few resources and some of the services that we have at the Career Center, just for some of you who might be unfamiliar and might be able to access these resources on your own time after the event, whenever you might need them. So let me see, can everybody see my screen okay? Cool. So first, this is our Career Center website. You can search it at careercenter.depaul.edu. A quick Google search of our Career Center will also do the job. We have a lot of stuff on here. First, what I really wanted to show is under resources, we have a career library. And this is a really cool place that, again, you can access from home. And we have so much help, like a lot of helpful information on this. From blog posts to career videos with quick tips and tricks, as well as well laid out PDF handouts. And these are great visualizations that highlight a lot of different career and professional development topics, from resumes and cover letters to interviewing, networking, help on job searching and internship searching, all the way down to graduate school and career exploration. So there's a lot on here that's available to you at home. If you look through this and it's kind of confusing, it's always helpful to talk to someone at the Career Center to get that kind of guidance and to really go in depth on a lot of these different topics. So we do provide career advising to students as well as alumni from DePaul for any questions that you might have related to your professional development. We provide virtual and phone appointments that you can schedule through Handshake. And on these virtual or phone appointments, you can meet with a specific career advisor or career ambassador from one of our career communities. And we have career communities that expand across a variety of industries, such as healthcare and science. So you can meet with me and we can have one-on-one appointments. We have other communities that are completely open to you. They're not limited to major or anything like that by any means. So if you're a healthcare and science major interested in business or in education, there's a space and a community for you to meet with a career advisor who can give you tailored information on those specific career areas. And we also have Zoom drop-in coaching and email resume reviews. So our virtual office is always open during our office hours for you to just come in without scheduling an appointment, to ask quick questions and to meet with peer career coaches to maybe review your resume really quick before you submit it for an application. You can also submit your resume through a Google form, fill in some quick information, what kind of feedback do you want, and receive email with written feedback on how you can continue working on your resume. And to kind of tie all of our resources and services to our event today, how I got this job and how we like to look for alumni, especially recent alumni, to kind of give you all a greater understanding of these different professions within healthcare and science. And we try to look for people who graduated from DePaul to see where they are now after their graduation. What have they been up to? And under networking, we do have our alumni sharing knowledge network, and all of these links and web pages I'm showing you are in the chat. And our alumni sharing knowledge network is a really great place to connect with DePaul alumni. And it's a really great place to build those connections and reach out and learn about different professions within the fields that you're interested in. And now for our event today, I would like to introduce our guest speaker, who is a DePaul alum, graduated as a double demon with not a double demon, graduated in 2016 with her background in health sciences and psychology, went to PA school, and is now a PA for Able Psychiatry. Valentina, so now I'm going to pass the stage on to you.
Hi, everyone. Thanks, Sabrina. I'm really glad to be here. I enjoyed my experience at DePaul a lot. So it's nice to be back, even in the virtual setting. I think the class sizes at DePaul really give students a good opportunity to get to know professors, get help when needed. You're not lost in the crowd, and I hope you guys are taking advantage of that. I know I certainly did. A little bit more about my time at DePaul. I started off as a psychology major. I wasn't really sure what I wanted to do. My family was kind of pressuring me to go to medical school. I thought I wanted to go to law school initially. I kind of had no idea and started with like a medical track. I switched to health sciences, and along the way I ended up getting a minor in psychology and in chemistry. A little bit more about my experiences outside of class. So I was able to do some research at DePaul. In my organic chemistry course, I met Dr. Ruben Para, and I just approached him during the class and asked if he had any opportunities for research, and he invited me to help him and participate in his molecular docking work. So I was fortunate in that it was a really kind of one-on-one experience, me and Dr. Para, and we worked on this software, essentially testing out different drugs in like a model like environment where we would just adjust the different conformation of the particular drug and see which conformation fit the receptor site like the most snugly. And this was a cancer drug. I don't remember the name of it, but it was a really cool project. And at the end of it, we were able to publish a paper. And so that was published in the undergraduate journal of chemistry. And then another research opportunity that I had at DePaul was during another organic chemistry course. This was my organic chemistry 3 lab. And in this lab, everyone in the class got to synthesize novel polymers. And then after the class was over, we were all cited for having synthesized the polymer. So that was a really cool opportunity as well. Um, During that time, I also worked at the SI office, the Supplemental Instruction Office. I worked as an SI leader for organic chemistry. And so I would attend lectures, and then after I would have little like meetings where we would go over different practice problems and I would answer questions and help out with the students. And then after that, I stayed on with the SI department and I did some other research for them. I wrote a paper. It wasn't a published paper, but it was a paper that documented some findings on like what are the best ways to teach sciences, what are creative ways to teach sciences. Um, and I really thought that the SI department was a cool learning experience because it taught me about the growth mindset versus fixed mindset. And I don't know if you guys are familiar with it, but it's essentially process based versus results based. And a lot of times um, we get rewarded based on a result, right? Like an A on an exam, that's a reward, that's an extrinsic reward. We don't get rewarded for how many hours we studied for the exam. And it's important to think about that as you go through school, but also as you go through your life to kind of find value in your toil, in the work that you do, and despite what the result is. And if there is too much of a heavy weight on the result of something, then it can be a demotivator for you to do that thing. It can make it more painful and less fun. Besides SI, I also worked as a waitress. That was probably where I made most of my money on the side. And then I also had some volunteering opportunities. So I volunteered at Rush Hospital and I worked there in the generic volunteer department. We would do a lot of miscellaneous things like transport patients in wheelchairs. We would deliver flowers, and sometimes we would file things away in different offices that needed help with organizing their files. It was a cool opportunity because I got to meet a lot of the other pre-med students at UIC, since the Rush Medical Campus is right by UIC. And that is actually where I met someone that first introduced me to the PA track. This friend of mine, he wanted to be a PA, and so he told me about how that worked, and that really changed my thinking about what I could do or what opportunities were out there. And so then, and I'll get into this later, but it wasn't until I took the MCAT course that I really started to question whether I wanted to be a doctor. And once I did that, I realized that I needed direct patient care hours for PA school. So one of the ways that I got my direct patient care hours was volunteering at a hospice, and the hospice was called Horizon Hospice. Their volunteers work with patients' families to help provide care for the hospice patients in the homes while their family members are like running errands or visiting other relatives, kind of giving them a break, because with end of life care, it can be really, really demanding on the family members. And these patients often have really high needs. So that's how the hospice volunteers can make a really big difference in their lives. So that's one way that I got direct patient care hours, was working in hospice volunteering. And then there was also a inpatient hospice center at Rush. So I was able to spend some time there as well. So that was my volunteering experience. And then my other clinical experience or direct patient care hour experience was as a nursing assistant. So I got a certification to be a nursing assistant at Wilbur Wright Community College. So that's like the city colleges of Chicago. And they had weekend classes. So I would attend their weekend classes while I was still studying at DePaul full time. But it wasn't a very intense program. So once I got that certification, I got a job at a nursing home in the neighborhood. And that's how I was able to accumulate some of my hours. As far as shadowing goes, I didn't get a ton of shadowing experience. I think I just shadowed one PA at Rush for a day, and I shadowed one nurse practitioner at North Shore for a day. So that, I think there are some people who get a lot of experience in that and some people who don't. I'm not sure that it was too helpful in like my path. I know that it can help a lot too, especially if you're looking for experience in a very specific specialty. Other things I did at DePaul, as far as student organizations, I was part of the hoop troop, so I'm not sure if that's still around, but we did hula hooping, and we went to different events and had hula hoop routines, so that was cool. That was fun. Now I'll answer the question of how did I decide to become a PA and how did I transition from pre-med to PA? So I'm not sure exactly when this happened in my path, but I was on the pre-med track and I signed up for an MCAT course because the MCAT is a big landmark thing that you have to do if you want to go to medical school. And it was so overwhelming that on the first day, it pretty much made my decision for me that this is not for me. I realized that I wasn't passionate enough about being a doctor to go through something so intensive. And at that time, I had a lot of science background. I enjoyed science. I wanted to help people, but I wasn't willing to do the time commitment. So the full 4 years of medical school plus residency, I mean, the MCAT class was overwhelming, but I knew that it was tied to this other big burden of 4 to 8 years of additional schooling and education. That freaked me out. And also, I didn't know exactly what specialty I wanted to work in. And with being a doctor, you pretty much specialize unless you're an internal med or a general provider. So that you're kind of stuck with that once you decide. And so for me, it was pretty easy once deciding not to go down the medicine route to be a PA because it was quick. I mean, 2 years seemed really doable for me. It offered me the opportunity to work in multiple specialties, which I liked. At that time, I wasn't so sure that I knew exactly that I wanted to be in psychiatry. The GRE seemed also more doable than the MCAT for me. And I like that there wasn't a residency requirement for PA school. I really liked that I could get this degree and then start working right away. I wanted to stay in the sciences. I wanted to help people. And I also wanted to be financially independent and be able to have a good income. But I think it was a pretty easy decision for me at that point to go into the PA track. So why psychiatry? I've always been interested in psychology. I started with that as my major, but once I had more clinical experiences in PA school, it became much more apparent that that was where I would be the best fit. I didn't enjoy the hospital setting very much, and I didn't really enjoy doing physical exams and touching people, which you do a lot as a doctor. And I found that I enjoyed talking to people more than anything else and hearing their story. And I was able to have a psychiatry rotation, and that was the highlight of my clinical year. So it became pretty clear to me that psychiatry was going to be it. Now, graduate school, so PA school, how was it? I can tell you that it's not the same amount of fun as so enjoy your time now while you can. I applied to the Chicago schools, so Northwestern, Midwestern, and Rosalind Franklin. I ended up getting into both Midwestern and Rosalind Franklin off the waiting list. So that was very anxiety provoking. I think I found out maybe a week or so before the program actually started. And something to keep in mind for those of you interested in PA school, most PA schools, at least the ones in Chicago, start in May. So you might want to finish in the winter quarter, or take some classes during the summer if you can, to get yourself on track to finish early, because if you are finishing in the spring, you might be taking classes at DePaul while you're starting PA school. So, and I know that does happen with the capstone program, because when my first year at PA school was the first year that not the capstone, but I forget what that program is at DePaul, where you guys get like undergrad and like a graduate couple years.
Through the Pathways Honors Program?
Pathways, yeah. So the year that I started, the Pathways students were actually finishing up their spring quarter at DePaul while they were starting grad school, and that was really, really stressful for them. So timing wise, one thing to keep in mind. I was able to finish in the winter from some AP class credits, so take advantage of those if you have those too. I ended up deciding to go to Rosalind Franklin because it was a cheaper, shorter program. Midwestern would have been another, I think, $10,000 for like 4 more months of clinical experience. And I didn't know if that was necessarily worth it at the time. Now, the drawback with Rosalind Franklin was the location. It is in North Chicago, which is pretty far. I ended up commuting 50 to 90 minutes each way, and that was really horrible and really exhausting. I wanted to live downtown, so that is a choice that I made. A lot of students decided to live on campus, which has its benefits and its drawbacks. I commuted, but I still got to have the city lifestyle. There's not much to do in North Chicago, if you are wondering. So but you're also not going to have a ton of time to do stuff while you're in PA school. So it's not a bad decision to live on campus if that's something that you're open to. It was very overwhelming with the commute and with the course load and the very strict attendance policy, and very strict attendance policy for PA students specifically. So I will throw that in there. I didn't think it was very fair. Like the med students and the pharmacy students were able to have their lectures recorded and listen to them whenever they wanted and kind of adjust their schedule. But the PA school students had to attend every single lecture. And even if we were sick, we were definitely guilt tripped, and we had to email every single one of our professors on the days that we were gone. And so there is huge negative incentive for missing like even an hour of the school. So not sure if that's changed since COVID, but that was my experience. It was a grind, the 2 years, but it's just 2 years. And so for me, that was worth it to kind of have a limited life for a short amount of time. They say in PA school, you learn 3/4 of what you learn in medical school, and half the time they like to use the analogy of drinking through a fire hose. Like, it's just so much information, and you kind of like open your mouth and like accept some of it, and that's it. But PA school was a challenge, even though I came in from undergrad and just took a quarter in between. I still had to relearn how to study, and I had to relearn how to study because of the quantity of the information and the types of things that you were expected to learn. I failed my very first test in PA school. It was an anatomy exam, and I was like connected with some resources and tutoring after that and did okay. But it is a new type of learning, and it is getting comfortable with knowing that you're not going to know everything, and how can you know just the very important things that you need to pass the tests and also prepare for your boards. The PANCE is the licensing exam for PAs, and most PA schools teach their content very closely to what the exam is going to ask of you. And it's important to know too with PA school that you won't know anything fully right away. Just trust that, you know, you'll learn about it in one section, you'll come back to it, you'll see it during your clinicals, and it will be cemented over time. And that can be unsettling to some students who want to kind of know it perfectly and know it right away. So it is a different approach. But I got through it. It was okay. And towards the end of clinicals, I started reaching out to providers who were in Chicago. One of the professors at Rosalind, he had given us the piece of advice of most physicians that are really good, are really busy, and they might want to have a PA, but they don't necessarily know about you or what you do or how to find you. So just find physicians who are out there that are cool and contact them. So I took that approach in trying to find a job, and this was towards the end of the program. I reached out to different psychiatrists in Chicago, and that's how I connected with Dr. Salaj, who I still work with today. He was in that same boat of like working by himself, needing more help, having some knowledge of like what PAs do, but not really knowing how to implement one or where to get started. And so we figured it out, the two of us. And since then we have two new PAs that have joined the practice, and another psychiatrist and a couple other team members. So that's been really cool to see the business grow in my time here. Another piece of advice about post PA school is that you really want to find a job where you will be taught. There are a ton of opportunities for PAs out there, and they seem really appealing, and they're going to throw a lot of money at you. And just be careful that they don't throw you out to the wolves, because PA school is really fast, and you're doing this, you're getting this degree with the hope that you'll be trained really well at your first job. But if you aren't trained very well at your first job, you're going to have a huge stunt in your growth. And it's scary, right, too, because and even new physicians don't feel confident when they first start out. So it's really important to have a mentor, someone that you can ask questions, someone that is like expecting you to not know what you're doing, basically. And so keep that in mind, that if it's a good growth opportunity, that might be better than a more appealing pay stub at the end of the day. Because if you get good training, then you can go anywhere. yeah, I didn't have a hard time finding this job. When I took this job, I had a couple other options for outpatient psych and outpatient neuro, some of which I'm really glad I didn't take. I think they would have burned me out. So always important to ask, like, how many hours are the other PAs working? And two, like, if you're a new PA and you're being interviewed by the physician and there are other PAs at the practice, try and talk with them, see what their experience, how happy they are. That's one way to get an idea of whether you might be a good fit or not. But I really love working in outpatient psychiatry. It's very rewarding. I love hearing people's stories, and I think if you talk to someone long enough, you'll find something in common with them. You'll find a reason to like that person. You'll grow to like them more over time. Our patients really do get better, and so that's cool to see someone get better. And I think we get to know people on an intimate level that not many providers do, especially with how quick some appointments are and how long time passes in between follow-ups, like in, maybe an annual visit or every 6 months visit. It's not so often that other medical providers see their patients every month, but I see my patients for the most part every month. And so I get to see them sometimes at their worst, but I also get to see them at their best. And I get to see the progression of that, which is cool. Our clinic is also very unique, and we try different things. We were one of the first practices in Chicago to have TMS, which is transcranial magnetic stimulation. It's a treatment for treatment-resistant depression. And we're also now doing ketamine therapy for treatment-resistant depression. I don't know if anyone knows this, but we're in a really cool place with psychiatry right now. We're starting to get on the track of using things like psilocybin and MDMA for psychotherapy to treat PTSD and depression. And what I've seen with ketamine therapy has been really cool and turned around some of the most difficult cases. And actually it's a medication that has been studied for the last 70 years. So we have more data on it than some of the other things that are out there. So that's really cool. I find that really, there's a creative element about what we do too. And there's a lot of options to treat really difficult patients. Like, we don't send really patients to the hospital anymore because we have these more outpatient interventions that are really effective. So there's that. And I love the flexibility of my job. I work independently, so I can create my own schedule, and I have a lot of time to do my hobbies, to self-care, like practice what you preach, right? If you're working in psychiatry, you have to take care of yourself too. I love to travel. I have a travel blog that I work on in my free time, which has been a cool creative outlet and also kind of a fun entrepreneurial venture. So I love that my job allows me to have these things and isn't overpowering my life. Yeah. My future goals are to get better at psychotherapy. So that's something that you can always get better at, but I want to do more training, and there is a psychodynamic psychotherapy school in Chicago. So I hope to do a program with them in the future. And another cool thing that we might do in the future at our practice is have a therapy support group for women. And I think it would be a really valuable experience to lead something like that, to be a part of cultivating this group that gives women a safe place to talk about their problems and be heard and get help. So I hope that we can do that in the future too.
Thank you so much for sharing your career story, talking about your challenges, undergraduate and graduate school experiences. We already have a couple questions, and we have some time for some more. So Sean, I see that you raise your hand if you want to unmute yourself.
Yeah, thanks, Valentina. So I'm really interested in psychiatry, and lately I've become very interested in psychedelic therapy also. That's something I've been doing a lot of research on. So I'm glad you mentioned that. And in general, I'm just wondering well, first of all, I just want to know how I can I want to know like what part of the process you take part in during like a therapy session in general, but also specifically psychedelic therapy, and how it's different from a psychiatrist's role.
So my role isn't different than a psychiatrist's role. At our practice, we do longer appointments with more therapy. So my appointments now are 1 hour for a new patient and 30 minutes for a follow-up. In the beginning, I had 1.5 new patient visits and 45-minute follow-ups. And so during my visit, I do an assessment, and then once I have enough information to determine whether I need to make a medication change or not, then I spend the rest of the time doing psychotherapy with my patients. Our psychotherapy style is a little bit more direct. It's a little bit more like psychoanalytic and kind of Freudian rather than CBT, but most of our patients do still get therapy from like a weekly therapist as well. Now that we are working with the 2 new PAs, they are having the opportunity to practice their psychotherapy skills and do psychotherapy during ketamine. I haven't done that in the past, but it's something that I could do if I wanted to do that. Does that answer your question?
So you don't need any specific certification to do therapy with ketamine and other drugs?
No, as a PA, with having a license as a PA, your license is kind of limited by the physician that supervises you. So if I work with a physician that does psychotherapy, then I can do psychotherapy. It's kind of like if you work with a physician that does like knee replacement surgery, you could then do a knee replacement surgery. So and that's where that training piece is really important, because technically someone could sign you on to supervise you and you would have the like authority, I guess, to do a certain procedure, but you would really have to feel confident that you could do it. And some like clinics are more, they're less risk averse and they're just kind of like, all right, do it, try it, but especially with psychotherapy, it's something that you want to really know how to do it. And I worked under Dr. Salaj for 2 years actually before I started seeing my own patients. So I had a very, very extensive training period. And first I only shadowed. So I kind of did my shadowing after PA school, if you would believe it, but I shadowed him for almost like 4 months before I started seeing patients with him. And after I started seeing patients with him, I would see the patient beforehand, and then he would see the patient after. And after I saw them, I would make like a care plan basically, and he would modify it. So I had a lot of oversight and feedback for a significant chunk of time before I started practicing on my own.
So that's really cool. Is the main difference then between a physician and a PA the fact that their licensing, their practice determines what you're capable of doing, but you essentially do the same work as them under them?
You do the same work as them. It's just the education. The difference too is like I couldn't have someone work under me. So I couldn't open up my own practice. I think, well, maybe I could, but it would have to be tied to another physician. So it kind of depends on like, do you want to have your own business, or are you okay like being collaborative?
Okay, awesome. That's really good information. My other question was whether you have the opportunity to conduct research as a PA.
Yeah, so that is something that is an option in my job, and we have so many ideas and so many different things that we want to do, and there were talks of like doing some research with TMS specifically. The limitation is my time and my involvement. So if I wanted to in this role do any kind of research, I totally could, but at this point, I'm happy with my schedule as is. So it's kind of my own lack of motivation to do that. But yeah, you can.
Thanks, Valentina. That was super helpful. Appreciate it.
We have another question that came via message. Question is, how important would you say that networking has been for you throughout your career journey? You talked about volunteering and meeting some other aspiring PAs and doctors at Rush, and you talked about some connections that you made in PA school, but what else can you tell us about networking throughout your career?
It's a good question. I was never really good at networking. It's hard for me to kind of like talk to people in this like kind of not deliberate way, schmoozy kind of way. So I didn't network at all. And again, when I met Dr. Salaj, I was just randomly emailing psychiatrists in Chicago. So there wasn't like this person knew that person kind of thing. But networking can be super helpful. I think it also depends on like what kind of context you want to work in, what kind of work you want to do. There are different jobs that might be much more helpful in getting.
Kimberly, looks like we have a question.
Hello, yeah, I have a question. So Valentina, I know that you've mentioned that like you've built a lot of your clinical hours and have a lot of experience within that. So I just wanted to know, like, when did you start building those hours? Like how early? And if you knew, like if you know or remember like the requirements in order to apply for a PA school, like minimum requirements?
Yeah, it's a good question. I'm sure it's changed too since then, but I don't think I started getting the clinical hours until my junior year. I think junior year would have had to be the earliest, or maybe I even took my CNA class junior year, because I definitely didn't have whatever the requirement was when I applied. I think when I applied, it was stated like you have to have I want to say whatever number it was, you had to get to there before you started. So they kind of looked at it like if you had a job, like let's say your job was 20 hours a week, count it forward and say like by the time you started the program, you will have that many hours. And that's what I did. I definitely didn't have the full amount when I applied.
Okay, thank you.
We have another question that was sent in to clarify on some of the questions from Sean. To follow up, as a PA, are you allowed to essentially do the same duties as a physician if given the complete freedom to do so? And would this only apply for psychiatry, or is this the case in other specialties or areas?
It is the case. You do have freedom. I think it really just depends on your relationship with your physician and the context in which you work. But you know, you do all the same things, you prescribe all the same things. I think the only place that it would maybe be a little different is like if you get into really, really complicated surgical stuff, then you know, you'll have to have much more extensive training And in that case, are working really, really closely with the physician. I mean, there are PAs that do their own surgeries, you know, like but those are usually things like knee replacements and hip replacements. There are a ton of PAs in ortho that do all their own procedures. But when it comes to more like intricate cardio type stuff, I mean, you're on a team with probably some physicians, and you kind of collaborate and learn as much as you want to learn, I guess. Does that answer your question?
Yeah, thank you. Other questions, feel free to unmute yourself and ask, or again, you can send them to me in the chat. I'm sure, Kimberly, please.
Yeah, I just have another question. So, after like graduating or like finishing PA school, did you pick your specialty during or after?
So as a PA, you don't have to pick a specialty. So like if I decided tomorrow, like I'm done with psychiatry, I could apply to like a surgery job and I could start working in surgery. How easy would it be for me to get a surgery job? Like probably not that easy, but there are stories of PAs that like work in one specialty and then work in another specialty. And then there are some specialties that are much easier to kind of flip between. Like if you could go from an internal med to an ENT to a allergy. That seems very related, but you don't always have to. And that I think is a benefit of the profession, because if you do find that you don't like a specialty, you're not stuck in it forever.
That's very helpful. Thank you.
Other
I
questions?
have a question. In your opinion, what is the most important quality of a PA applicant that PA programs look for?
PA programs are looking a lot for work experience. I think they want to see that you've gone out and done stuff, and whatever that stuff is. I don't think it matters as long as you can show that you've had real work experience and practiced working on a team. I think collaboration is really big with the PA profession as well, because you are working under someone technically. So you have to be okay with that. You have to be okay with asking for help and asking questions, and all of medicine is kind of moving in that direction as well, the collaborative approach. So if you can demonstrate that you've worked on a team, that and what qualities you've been able to kind of cultivate through these different work experiences, that's going to help you look like a good applicant.
Thank you.
Did you go through DePaul to find those work volunteer experiences, or did you go out on your own?
So the research was all through DePaul. My job at SI was through DePaul. I think Rush volunteering, that was on my own. The Horizon Hospice volunteering, that was also on my own. If you're interested in psychology or psychiatry specifically, I do have an idea for you that might be a cool experience to look into. So there are what's called IOP or PHP programs. Some of them are Compass, Insight, SunCloud. And what these programs are essentially day programs where patients get therapy and group therapy and skill building during the day, and then at night they go home. So it's kind of a step down from a hospitalization. But if you can get a job at one of those IOP programs, like a coordinator or like an intake person, it's great direct patient care experience in psychiatry, and you don't necessarily have to be qualified for a lot of the jobs in those programs. So I would definitely look into that.
Thank you very much. That's awesome. You said IOP, PHP, they're the same thing, or is that?
So IOP just means intensive outpatient, and PHP means partial hospitalization. And most of them have both, where like one is like a higher tier than the other.
Okay, beautiful. Thank you. That's awesome.
We have another question from a student who is in a very maybe similar situation that you were in, who is deciding between pursuing a PA track or an MD track, and was curious to know a little more about your MCAT experience, and was wondering if it was very overwhelming because it was a huge exam, or kind of if different studying resources would have helped with that overwhelming feeling, or if it was more, this was not the right fit for you. And kind of related, do any of your patients ever kind of question your license or position as a PA and say they want to see a physician, or do you feel like you are treated equally as the physicians you work with?
Yeah, I mean, I do think there's always going to be people who are more comfortable with seeing a physician, but I think that the culture is starting to change because physicians are becoming more and more busy, and now it's the PAs that spend more time with their patients. So I think there's a little bit of a shift happening, but there's definitely people who are like, I only want to work with a doctor. And usually I say those are not the people you want to work with anyway. It's like, okay, go ahead. If they're that kind of rigid and dismissive, then they're not going to be a good patient for you. And then back to the MCAT class. Yeah, I'm sure if I had really wanted to do it, I could have done it. I think the MCAT class opener of, it was just a very in the moment, very in my face kind of example of like what the whole MD process was going to be like. Like it was going to be a big commitment. And I think I just didn't want to commit to that. Like I wasn't okay with the time plus the intensity. I think with PA school, I was okay with the intensity because the time was so short. And, I think, it just depends. Like, do you really want that title or not? I'm happy not having that title. And I think maybe so because I found a mentor that was willing to train me so well. And maybe that wouldn't be the case if I didn't, and if I just was thrown into a situation where I didn't have the title or the experience.
All right, we have time for one more question. Anyone has one?
What's your schedule like right now? Your work schedule?
My schedule, I work from like 12-ish to 6-ish. So kind of like 30-ish hours a week. I could work earlier or later if I wanted to. Usually with psychiatry, you want to like leave some later in the day appointments for people. And I think it just happened naturally because Dr. Salaj working, I think he was working 1 to 7:30 when I started. And at the beginning, my schedule was very much tied to him. So I eventually dialed it back a little bit, but it's been nice to have mornings to do my own thing. Like I still wake up in the morning early, but I have time to exercise and meal plan and do other things. And then I kind of come to work at 7:30 and then I'm out by 6.
Actually, oh, sorry. Does someone else want to talk?
You're good. Continue with your question really quickly before everybody starts to trickle out. I'm going to launch A really quick exit poll just to gain some feedback on this event. As I'm launching this, feel free to do it on your own time and you can continue with your question.
Okay, thanks, sorry. So Valentina, I was wondering, I was also thinking of applying to like Midwestern, Rush, and like Rosalind Franklin, as well as like Northwestern, but I was just wondering, like, can you tell us how the interview process was like when you submitted your application?
Yeah, so I only interviewed at Rosalind and Midwestern, so I didn't even get an interview at Northwestern or at Rush, which I think I might have applied to those four. At the time, they were doing what was called like a mini mock interview, MMI. So there was that. And I also remember that my interview at Rosalind was very traumatic because the interviewer asked me how old I was and I was only 24. And then he was like, oh, you'll have plenty of years to apply in the future. And I was like, what? So not the best experience. That's pretty much like the only thing I remember from it.
Okay, I was just wondering, thank you.
I'm surprised that they asked you how old you are.
I know, I felt like that was so unprofessional and jarring. Like I didn't know, like at the time I just told him, but I like have since thought about it and like, I think I probably should have been like, does it matter?
Also borderline illegal. Actually, not borderline. I believe you're not allowed to ask that in a job. I don't know if this counts as a job interview, but you're not allowed to ask that. So
Yeah.
part of anti-discrimination legislation.
I did speak about it and well, I did report it later when I was accepted to the program, and in the program, I did report it to the program director. So.
Thank you, Valentina. This was really, really helpful for me.
Yeah, and
Yeah.
if students have other questions, is there a good way to get in touch with you?
Yeah, they can email me. Do you want to share?
Sorry, I will share your email address here in the chat. Thank you.
Thank you.
Yeah, thank you so much, everyone, for coming. Thank you, Valentina, for sharing your experiences, answering questions, inspiring everyone. And I hope everyone has a great night.
Thank you.
Thank you again.
Thanks, everybody.
Thank
All right.
you.
Have a good weekend. Bye, guys.
Thank you so much.
Yeah.
Paige, any other questions that we can answer for you?
Oh, sorry, I wasn't by my phone to get out
That's
of it.
okay.
Okay,
No,
thanks, bye.
bye. That usually happens. Someone is still on Zoom.